So now we're going to show how a regular person can actually use muscle testing for their benefit at home for their own health. So, Dr. Jerry, how would we start? Essentially, we're going to need to know what's positive and what's negative. So what's a good way for a person with their partner to show that?
Yeah, so the first thing about this is that, this is an art and science of muscle testing, and most practitioners do, take, seminars and years and courses of training to actually perfect this. So it may take a while to perfect, but you can start by just having a patient and a practitioner. And today we're just going to check the deltoid test. This is just a straight arm reflex pull down test. So if I were to push down, I would just have him meet my resistance. And that's nice and strong. And just to see that he's testable, I would just actually go to his pineal point. And if I went here, it would go weak. And that means he's testable. If I flipped it around, you have positive and negative polarity points. So he should only test weak on one of them. And if he's not going weak on any of them, that means his body is not polar, or it could be the body is dehydrated. So you can have him just have a sip of water or drink a little bit of water or hold some water in the mouth and recheck it and see if that tests again. So these are things that I've learned at seminars that we kind of go over before we start learning muscle testing.
Okay. And some other ones that you mentioned, that somebody's very stressed out or they're thinking very negative thoughts. Or
if someone's very stressed out, it might have, the testing might be a little off. Or sometimes if the patient is really blocking or like not wanting the practitioner or the person to muscle test them, they can cause a block as well. Or sometimes it's the practitioner themselves that doesn't trust their muscle testing. So these are all different factors that can affect the muscle testing in that way. If that is the case, then there is a block. You can have the practitioner just kind of remove himself, take a step out, and then come back and then just do the testing themselves. But a lot of the thing with muscle testing, the most important thing is that you want to keep neutral. Okay. You want to keep a neutral mind state because you don't want the biased to run the muscle testing.
So, for example, if we're using this with certain supplements and I really want to take that supplement, that's going to make it
it could change the muscle testing, absolutely.
Okay.
Yeah.
So essentially, if we're at home or we're in a health food store and we're wondering what supplements we can take, how do we go about testing to see if our body needs those nutrients?
Yeah, so what we would normally do, and through my years of training and from my mentors, we found that the most reliable testing is actually underneath the chin. Well, actually, aside from that, because the origins of nutrient testing came from neurolingual testing, meaning we would actually test the actual muscles that relate to the organs, then you would actually put the nutrient on the tongue because the tongue has sensory receptors or the gustatory receptors, and that will signal the brain to tell what is actually going on in the body, because we know that digestion starts in the mouth. And so if the person chews or tastes that supplement, it's going to cause a signal to go up to the brain, and the brain will output the nervous system impulses to the body. So that's more of where the neurophysiology part came from. But again, throughout the course of the years, energetic testing has been a little bit more popular, and they found that if the body has a frequency or is resonating at a vibration, so do these supplement capsules. So to test to see, the most reliability is to have the patient hold it underneath the chin, and this is again from my
I have to hold it myself rather than you hold it underneath my own chin.
Yeah, have it underneath the chin because it's right underneath the sublingual or parotid glands there, and then we can have him hold the test and see if it's strong or weak. And in this case, it's actually going weak, and so that would mean his body's not resonating with that supplement.
Okay, so essentially I don't need these supplements then. And it's funny because I take these, so maybe it's because I took them this morning.
Okay, yeah, so these are essential fatty acids, and so absolutely, so maybe that's the reason why his body isn't test for it. And it doesn't mean that, so it could mean a lot of different things. It could mean, the supplement doesn't resonate with him.
This particular brand.
This particular brand doesn't resonate with him, or maybe his body has ample amount of essential fatty acids and that's why he doesn't need it.
Okay.
So there's different variable reasons why the muscle may go weak with a certain supplement.
Okay.
Yeah.
And depending on what actions you've taken, say if you've worked out or you've eaten a lot of food, you might need, like you've told me before, a digestive enzyme.
Yeah.
So you might test positive for that then.
Absolutely.
At that point.
Yeah, and so that's the beauty of muscle testing, is that it captures what's going on with the body at the moment in time, and we can get that snapshot through the muscle test.
Okay. So essentially what we need to know is, and tell me if I'm wrong about this, if we test for it and we test strong, put it underneath our chin here, and that means our body wants this.
The body is doing well with it. Yeah, it resonates with it. Yeah.
Okay, good. So now that being the case, How often do you recommend that we should test if we're, say, buying a month's supply of it? Do we test it every week, or then at the end of the month if you're going to buy another one?
Yeah, again, I would recommend seeing like a professional applied kinesiologist or a certified kinesiologist that has experience doing this testing. But a lot of the times, yeah, you can just kind of gradually check throughout, the weeks progress, because again, the body is so dynamic and is always changing. It's not linear. That's the biggest one of the lessons that I've learned throughout this is that, if you get an MRI or X-ray or blood test or lab test, that only gets what's going on at a moment in time. And so the beauty with the muscle testing is that we can constantly check this and to see if the body really needs it or not, or is it repelling it or not resonating with it.
Okay.
So yeah, just bi-weekly, weekly checkups, monthly checkups, just to see if your body still needs it is always optimally is always optimal.
Okay, great.
Yeah.
And if a person wants to essentially practice with this and become better at it, how would they use like the things you taught me, the positive and negatives, in order to?
Yeah, if you go into the book "Your Body Doesn't Lie" by Dr. John Diamond, a good friend of Dr. George Goodhart, of the father of applied kinesiology, in that book he actually has a few tests that you can do to show whether the test is positive or negative. One of the things is you can actually have the testee look at a smiley face, and when they look at that smiley face, because of the positive energy, the muscle should actually go strong. But if the person looks at a sad face, negative energy, then it actually might go weak.
Okay.
So that's one way you can test. Another way that he also mentions in the book is if you have the person think about like positive thoughts, or someone such as like Abraham Lincoln, who was known as an American hero. If you have the person think about that person, the muscle test will go strong. But if you have them think about someone like Adolf Hitler, it will go weak. So those are different things, just different thoughts or different energies that you can have the person test with.
So that's essentially a good way to practice to know sort of which is positive, which is negative, and for both people, because we're talking about allowing people to do this who are not a doctor and patient, essentially, is they can practice this at home, and that's a good way to do it.
Yeah, that's a good way to try, to start.
Okay,
Yeah.
great, good stuff. All right, well, if you are in Los Angeles, I would highly suggest coming to Kin Health and Wellness here, which is in South Pasadena. And if not, go to, as a doctor recommended, to go to a kinesiologist near you. I'm going to include the address for Kin Health and Wellness not only in the YouTube information box below, but also in the blog at The Art of Unity. I would highly recommend coming here and getting treatment with Dr. Jerry. And I hope this works well for you. Best of health and good luck.